Okay, I will start. Good afternoon and good evening for some of you. Thank you for joining February's call. As you can see, we're not in the usual home today since like OHDSI MS Teams channel environment has been a big technical meltdown again. And I really thought we had it like fixed last week, but apparently it decided to keep us on our toes. So we're here, and it looks like the things might be a little bit bumpy for a while, but so please bear with us, and we will navigate these digital hiccups soon. So, but however, the good news is we're still here talking, and you guys all have my emails and songs, and everyone has their institution's emails. So, if you have any burning questions, you can email me or contact anyone who is available. And okay, let's get started. We have like two topics to cover today. And first, it's a OHDSI news. And then we have newcomer and volunteer welcome session. We have Septi, Nelly, and Lynette. And yeah, okay. For the OHDSI news, OHDSI Europe Symposium 2026 registration is now open, and which will be held in April 9th, 18th to 20th in Rotterdam. They will have a main conference day actually on the ship. It's called SS Rotterdam. It's a stream. I forgot. It's about the ship anyway. So it's the main conference day is gonna actually on the ship. So if you guys anyone who are interested in the Europe Symposium, you can scan the QR code and hop into the ship. I remember last year was in prison, and this year they are having the conference on the ship. So I think it's very, unique and very. I think they really have their humor, you know. Um, and they got the details of the program, so I got a little infos for you guys. On the first day of the symposium, April 18th, the tutorial will be at the Erasmus Medical Center. Whether you're a complete OHDSI newbie or you're a Seasons Pro, they have like specialized tracks for everyone, from the introduction to OHDSI and OMOC, to advanced ETL development and phenotyping. Um, and you will also have let me get that radar point here. Um, you will also have a chance to experience Darwin packages for your own studies. So there's so much to choose. So good luck with your choices. Choose wisely and don't forget to breathe. Okay. So and then for day two, they have like national node meetings in the morning, so to see what's everyone's up across the Europe, and during the afternoon session, they will be like diving into a thematic deep dives, which will be like oncology and AI and more. So I believe it will be a really good chance for you to find your data partner in Europe. So anyone who's interested, please register for the Europe Symposium. Finally, for the Monday, which will be the main conference day, you will actually get on the ship. They will have a collaborators showcase and posters, and also the OHDSI Titan Award winner's speech gonna be there. I remember there's a lot of OHDSI Europe people, collaborators who actually won the Titan Award last year. So that's the thing. So I believe it's gonna be a full day of sharing their OHDSI Darwin like stories on expanding the systems here. And for the global symposium again, as you guys all know, that's gonna be on October 20th to 22nd, and as usual, New Brunswick, New Jersey. one more updates will be the plenary and tutorial sessions. Sessions will be for the plenary session. The sessions will be 60 minutes in duration, and these are needs to be most touched on the at least of the following pillars, which will be open community data standards, methodological research, open source development, and clinical application. They must involve 3 or more on-stage participants across the at least 2 organizations. It will be including keynote talks and panel discussion and interactive activities and more. And for the tutorials, they are actually aiming to deliver educational content such as like scientific, technical, and other skills. They are targeting 4 hours in duration. Um, I know there are several people from APAC who already signed up for the tutorial sessions, but the thing is, the registration for both plenary and tutorial sessions are extended to February 20th, so it will be day after tomorrow for Asian regional time. So anyone who are still interested, you guys can register and sign up for the tutorial and plenary session in the
It's not
globals.
registering. Sorry.
It's
Just
a
go on.
signing up.
No,
Yeah,
no, no. It's no. This is call for proposals for tutorials and call
yeah.
for proposals for
Hmm.
the plenary sessions. You're
Yeah,
not
that's what I
registering
meant.
for the sessions. Yeah, we're
Okay,
not
that's what I
registering
meant.
for the symposium.
Yeah,
So
they. Mhm.
if you still want to do a tutorial session, like you be the teachers at the symposium for like a
Mhm.
session, that's what this is for. Or
Mhm.
your team wants to give
Mhm.
a plenary talk, right? A panel,
Mhm.
like a panel
Yeah, yeah,
discussion,
yeah.
right? That's what this is for. The registration for the actual symposium and the registration for students has not started yet.
Hmm. Actually, that's what I meant, but yeah, my bad. Anyway, who wants to give a tutorial or give a plenary session, you can sign up for your proposals and give it a try. And for again, Odyssey Latin America 2026 will be held for the first time. I checked the program and I went to the website again. There is no updates yet, so I couldn't see any details, program or venues. But whoever interested in Latin America, then you can join. And another news in Odyssey, there's gonna new bite-sized video learning pathway course, and I saw Ellie's got to give us a promotion about it. And this course was developed in the collaboration with Dr. Daniel Prado Alhambra's team at Oxford University, and it's mainly designed for both researchers and data holders. It will walk you through how like standardized infrastructures like Odyssey, CDM enables reproducible and federated analytics. So I actually went on ahead and checked the program myself, and it's about an hour long and totally free. So if you are curious or getting just started with the of CDMU, I kind of really recommend it because it's really a low barrier way to get up to the speed on some of the core concepts without the heavy time commitment. So, yep, and that's it. So, as I told you guys at the earlier at the beginning of the call, so since we had the Lunar New Year holiday, so I believe we are officially in 2026, which feels like it's a really great moment to look back on the past year. Um, so this is the slide deck I used last year's community call. I still remember like sitting right here as a newcomer. Honestly, not quite sure um, what I was doing and what I was going to do it, but here I am presenting anyway. So I believe a lot of things have changed since then. Over the past year, I've grown like tremendously, I believe, and I wish. But also both in terms in like where I want to take my career and in my development as a but more than anything, what I cherish most is the people I met along the journey in Odyssey. So getting to know so many people and collaborators from across the region has generally expanded my world in ways that I didn't expect it at all. So I definitely grateful to everyone who has supported me, especially Song from last year. He helped me a lot and I learned from him a lot and also from a lot of like team members. But Song always being very modest, but yeah, he's very he was very helpful for me. And yeah, and thank you again. And so, and on that note, today I'm especially excited to introduce three people who are, sorry, three people who have already joined the Odyssey APAC and who are recently joining the APAC as a new volunteers for the Odyssey APAC community. They've jumped in with the dedication, and I can't wait for you to get to know them. To get to know them, and this is really good chance for you, all of you, I believe. So Septi and Natalie joined as a volunteer from this year to help me running this APAC community call. um, I didn't have like proper opportunity to get to know them yet, so I believe today is a really good chance. Um, and also we have Lynette. She gave us a short presentation last year in the community call, and she's with Mukesh, and also happy to know Lynette too. Okay, so before we actually get started with the welcome session, um, as many of you guys know, Odyssey APAC community runs entirely on donated time and efforts of the members. So please join and poke me if you're interested. And so we APAC working group is very warm and welcoming, so no worries at all. And I will shush now. And let's Septi to share her screen. You can go ahead, Septi.
Okay.
I stopped sharing. Yeah.
Can you see my screen?
Yep.
Okay. Yeah. Hi everyone. Good morning or good afternoon, or also good evening for most. So my name is Septi Melissa. Maybe some of you already know me. I'm a PhD student at Sape Medical University, and yeah, today I want to briefly and officially introduce myself and how I became involved in the Odyssey community. So a little bit about my background. So before I came to Taiwan, I worked as a nurse in Indonesia. So first I worked as a medical surgical nurse, and then I transferred to intensive cardiac care unit, where I have like a chance to managing patient with acute or chronic cardiovascular conditions. And then on 2020, so right after, like in the beginning of pandemic, so I moved to Taiwan to pursue a master degree in healthcare administration, where I developed a strong interest in quality of care and patient safety, and also health information system and digital health. Um, so basically, through my clinical experience, I found there's a gap between like bedside care and also data-driven decision making, which led me to pursue research using real-world healthcare data. And yeah, this is me when I first being the frontliner during the pandemic. You can see, yeah, in the back, there's a tent which where we take care of the patient with the suspect of COVID. Yeah, you can see like yeah, it's not ready yet. Yeah, but yeah, it is what it was before. And then, yeah, my current role right now. So currently, I'm a PhD student in the my program called International PhD Program in Biotech and Healthcare Management in Taipei Medical University. So my advisor is Jason. And so in our lab, we have like several study groups, and I'm leading one of the study groups in Jason's lab. And I also serve as a teaching assistant in hospital clinical data analysis courses, which is taught by Jason and Alex. And so my research focus in is to improving cardiovascular outcomes after inpatient after percutaneous coronary intervention using real-world data, particularly observational studies and predictive modeling. And since yeah, like end of last year, I um, involved in the OHDSI APAC community, basically helping in planning and organize community calls. This is what I know my role. I don't know, like, is it really what it's about or not? Yeah, you can see this is my lab member. Yeah, this is how many people that join our lab, and this is also like how many people usually um, join the lab meeting every week. And so my Odyssey journey, so basically I was being introduced to Odyssey and OMO during the APEC symposium in Taiwan in 2022. So before joining, before that, like I have no idea what is like OMO, what is Odyssey community before, and then because I joined Jason's lab, so I know what it's about. And yeah, maybe before joining Odyssey, I managed thought research with a single hospital data set is enough. But yeah, it kind of changed my perspective now that now we can file that findings across multiple countries and populations, which makes the evidence more reliable and clinically meaningful. Yeah, and then on 2023, I joined an assisting TMU team in Odessa study group because yeah, in our lab we have several study groups that um, mainly aims to help the lab members to know about yeah basically yeah we want to learn together, so we create these study groups. And then yeah, on 2023, it's also my first time attended Odyssey Global Symposium in New Brunswick also. Um, yeah, my journey continue on 2024 where I learned how to use the Odyssey tools. And yeah, through Odyssey, I learned how standardized data and collaborative research can generate reliable evidence across institutions and countries. And beyond technical skill, like the community also taught me how open science and collaboration can accelerate impactful healthcare research. Yeah, and then like start end of 2025, like I joined as the Odyssey volunteer for the community calls. So yeah, hopefully this year I can contribute back to the community and help promote real world evidence research in the APAC region. And hopefully this year I can start my own network study and share it to the community soon. Yeah, I think that's all my sharing.
Thanks, Septi. I didn't know like you joined like way before than I expected, like 2022. Like you're a you're like pro now, aren't you? Because you know, like
No.
I believe you know like much more than I know about Odyssey Pack. So thank you, Septi. And
Thank
yeah,
you.
yeah. I'm very excited to like work with you like for the rest of the year and more
Yeah, me
if you
too.
can. When is your PhD course finish? Are you when is there any expecting year?
Hopefully, I can finish this year.
Oh, this year?
Hopefully.
Oh, hopefully, yeah. Okay, we have like 1 year then. Okay, we'll move back, move forward to Lynette now. Or we have Natalie, right? Yeah. Natalie, whenever you're ready, you can start
Okay.
and share your
Hi,
screen. Hi,
hi,
Natalie.
Sophie. Can you help me to set the slide setting?
You're muted.
I will ask Septi to help me to set my slide. And hi, Chiquan. Hi,
Hi.
everyone. Yeah, thank you for having me. I'm Nguyễn Kim Hiền, but you can call me Natalie. And this is the quick get to know me. And I promise that will be very short enough so you can recognize me in the next community call. So I'm currently a PhD student in the School of okay. I'm currently a PhD student in the School of Nutrition and Health Science in Taipei Medical University, and my supervisor is Professor Jason. And I also have to lead our lab OHDSI group as a vice leader. And my main interest are respiratory disease, cancer, diabetes and its complication, and nutritional supplement. And nextly, my journey in OHDSI start in 2022 when I support the APAC symposium in Taiwan and first got introduced into the community. And what I love about this is that it turned the big clinical question into something that we can actually test in the database. And two idea make OHDSI special with me is you the common standard. So the data can be analyzed consistently, and it's enabled the network study where the organization collaborate without sharing patient level data. And in 2023, I joined the OHDSI Taiwan study group under the guidance of Professor Jason, and I start to building the hands-on skill. In 2024, I joined the first global symposium in the United States with the portal to predict the severe respiratory infection in diabetes patients. And in 2025, I also present about lung cancer treatment pathway in Taiwan using Team UCID. And now I'm volunteering with the OHDSI APAC, especially to help children and safety in planning and organizing community call. And thank everyone again. I really appreciate your time, and I'm excited to be a part of this community. And I'm happy to connect, especially with anyone new with the OHDSI. And if you have the idea for future call topic or speaker, you just want to say hi, you can please reach out to us. You want and safety also. Thank you. That's all for my sharing.
Thanks, Natalie. I didn't know you were in Global Symposium last year. It would be great if we like already know each other last year. So I had no chance to say hi, but hopefully this year.
Yes.
Yeah, and in APEC Symposium and Global Symposium, and very excited to work with you too.
Hopefully.
Yeah,
Thank
thank
you.
you. And we'll go to Lynette. Lynette, whenever you're ready, yeah, you can share.
Can you see my screen?
Yeah, we can. Very clear.
Okay. Hi everyone. My name is Lynette, and I'm a senior research officer at A*STAR, more specifically the Institute for Human Development and Potential, which is Mukesh's team. And I joined this team in May 2025. And previously, I was working as a software developer, specializing in innovation. So I work with emerging technologies, whatever it was. So at that time, it was AI. So yeah, it's still AI now. So and in terms of education, I have a degree in economics, and my competencies are in software development, such as for web applications and also in data engineering. So this is my OHDSI journey so far. It's not like very long because I've only been here for about 6 months, but um, it began when I first heard about this role, as in like my current job, and I was talking to Mukesh about it, and then he introduced me to like OHDSI and OMOP, and I was quite happy when I heard about all of this because I have a personal interest in working with healthcare data. I find it very interesting, and I also wanted to work more with data in general, so I felt like it's a very good fit for me. And so I got involved with OHDSI after starting my current job. And very happily, I've had the opportunity to be exposed to the process of OMOP CDM conversion by working with my team. And I've also learned a lot from my team, so I'm very grateful to them as well. And in the future, I hope to be able to learn from this OHDSI APAC community and also the larger OHDSI community at large because I think I'm very early on in my OHDSI journey, so I have a lot to learn. And I also hope to be able to contribute to the OHDSI community in terms of software development or any other thing that the community needs. I'll be happy to help. And yeah, that's pretty much it for my introduction. I think it's quite short. Thank you.
Thanks, Lynette. It's really good that we have like software engineer in our community. Um, we have like a lot of like chatting here, like people are like Song and we are like really um said like they look for he said and we said you're gonna turn into Wall Street genius because like since you said you major like economics but you like what was your turning point that led to you dive into the software engineering and data source and stuff? Is there any turning point?
So I did a few internships when I was in university, and then
Oh.
yeah, when I was like searching for those internships, then I was looking through all the job descriptions, and then
Uh-huh.
there was one about automation and innovation that really stood out to me, so I went for
Mhm.
that. And then from the internship, I got converted into a full-time staff, and then
Mhm.
I pursued like the path of software development.
Wow.
Yeah, while I was in that company, so it
Oh.
was like out of, I guess, interest. Yeah.
But you had no like you had like zero background of like developing or doing a software engineering before the internship, right?
Um, I guess like quite minimal at that time.
Uh-huh.
I Yeah, but then as time went along that I took more like modules in like software engineering and then like also external courses. So yeah, I also
Ah,
learned on oh yeah.
oh, nice.
The real reason is because us software engineering geeks are really fun and cool. Right? That's the real reason.
Yeah, it is
Oh yeah,
cool.
yeah.
It is really cool. Um, yeah, I saw Hanjay raise his hand before, but is that mistake or something? Okay.
No, I just wanted to see what people were chatting.
Oh, okay. You're bad. Anyone who has a question to Stephanie, Natalie, or Lynette? You can speak up, not typing on the chatting, right? You can just unmute and speak. I want to listen to people's voices here. Now I understand why songs doesn't stop talking at all, because people doesn't speak up. Okay. Song has his question. And for Natalie, nutritional supplements are not well captured in OMOP. How are you pursuing this research topic?
Thank you for your question. Actually, it's because my 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 program is about nutrition, so I just wanna share to you guys about one of my interesting topic. I know that nutritional supplement and also like something like dietary pattern haven't outside in ODC right now, but I hope one day it can be like we can have something some data like this in our community. And right now I'm working with the data in China is for the topic related with nutritional supplement.
Um, yeah. Yeah. No, Mui said that song's question is making you a hard time. So, but I understand the point, the why he asked that question, because I know that nutrition is also really hard to capture in AMAP. So, we usually use national database that includes nutrition. That, if I'm right, but I'm not sure what's going on in Taiwan. But yeah, hope
Hopefully.
yeah, hopefully. But that is really study, which is very like high needed and valuable, I believe. Yeah. And anyone else?
I'm a bit hesitant to ask this next question,
Go on.
but Mui's probably going to say I'm picking on Natalie again. But Natalie, so in TMU CRD, the source itself, not the OMA version of it, right? Does it capture nutritional supplements? Maybe that's another pathway you could take to pursue this specific topic.
Actually, it's not yet. We haven't like we in Team UCLD we haven't got the nutritional dietary data also. So that's why right now I'm using the another database to do the research related to this topic.
Okay, no, that makes sense. Thanks.
Yes.
And to be clear, I'm not picking on anyone. I'm just trying to help Juan from not being the only one constantly speaking, right?
Yeah, I understand you, Song. Thank you. Okay. Septi, and I heard that you actually worked as a nurse and you have like quite a lot of experience in the ward. So, um, like, so maybe I missed it or maybe I don't know, but do you like being a what do you like the most? Like, do you prefer being a nurse? And now you're like almost end of your PhD course, so I think it's quite a good time to ask you this question. What do you prefer? Do you prefer working on a table and sitting on the table and like doing a analytic stuff, or do you prefer working as a nurse, like meeting patients and make yeah and yeah, what do you prefer so far?
So being I started work as a nurse on 2013.
13.
And then and then I worked as long as 7 years. And then I think I feel kind of like burnt out before, and then because like I mean I like especially in the ICCU I like it because like I can be more focused on patients. But maybe like I kind of burn out, so like it's okay like to get away from, I mean, to quit the nursing job. But sometimes sometimes I still like dream of I have a dream about
Really?
the monitor.
Oh.
Because when you work in the ICC, especially in intensive care unit, when you back home, you somehow can still like listening to the ticking sounds of the monitor. But maybe it's just sometimes like I kind of miss the nursing work. But yeah, I think I enjoy where I am right now. Yeah.
Yeah. I'm not a nurse. I'm just, yeah, like, so I have no experience. I have zero experience in the hospital and with patients, but yeah, it seems really intense and but also very worth to be a nurse, but like you can actually save people's life. That's really good. but at the same time, yeah, like I think, yeah, it kind of traumatized, right? You see death and lives, and at
Yeah.
all the time, yeah.
But
So
I
yeah,
think the most like I mean like every moment kind of like memorable also, but I think the one that not really traumatized, kind of like memorable in like in both good and bad way. I think during the COVID,
mm-hmm,
because like yeah, it was so chaotic, and then
mm-hmm,
because it was the beginning of the
mm-hmm,
pandemic, and I had to helping the emergency staff
mm-hmm,
because
mm-hmm.
it's lack of nurses there, so like it was really a bit traumatic, but also like a memorable
Yeah,
time
yeah.
during yeah.
Wait,
Oh,
I have a question. Trying to tie Odyssey and a nurse together, right? So the question is, right, for someone who's been on in the field, where do you see like the Odyssey research? Where can it help you in the way you operate on a day-to-day basis? Or how do you see the research and the stuff that we do help you like interact with your patients? Now that's putting you on the spot.
yeah, I think the first thing what I want, I mean why I want why I'm interested in like digital health and health, I mean health informatics, and I think like I want uh I don't know how I can make this uh to to make the work for nurse and doctor easier, to less their burden, actually. So yeah, but I don't know how to do that. I don't know how to say it. But yeah, I think um because like before we don't really use the data in, especially in Indonesia. Like I think they just start like the electronic health record massively after COVID. So like yeah, I missed that chance uh using that technology in my own country. So yeah, I still don't know how to apply it in my own country, but basically what I want to do like policy and research in real world, like how we can like make their work become lesser, like yeah, less than their burden actually. But
yeah.
yeah, still a long way to go to do that.
I I know like even in our hospital we are trying a lot of things to lessen the workload of the nurse and the clinicians. So I think there's a really clear need for research that supports the clinical decision making and reduces the workload in the clinical settings like discharge and yeah and yeah and stuff like that. Okay.
Septi, Indonesia
Yes.
has recently formed a new chapter, right? I think it's in the process. You're part of the
Yeah.
conversation, I hope, right?
Yeah.
Okay,
Oh,
Yeah.
not a
excellent,
process. It's already been established.
It's
excellent,
already.
excellent.
Yeah. I
Congratulations.
think.
Yes, it's been
Oh.
established.
Oh. Okay. Yeah. I just know like I think a few weeks ago they already sent a letter of intention. I don't know because so the main members is in Indonesia, is in other city of Indonesia. So they're the one who sent the letter of intention. We just like helping in the background actually.
I
That's
believe
great.
George already replied and confirmed it, but I can double check.
Okay.
That's great. That's great that we have another chapter now, right? Indonesian chapter. That's cool. Maybe I need to update the Odyssey APAC news for the March. Right. Okay.
Yes, let's do a formal introduction in March.
Yes, yes, let's do that. Let's do that. Okay. So hopefully we had like very brief and light session today. But still we got to know Septi and Lynette and Natalie a lot from this conversation, like small group, but also have really good deep dive conversation too. So yeah, if we are good, yep, Mui, you can go ahead.
No, I just want to say thank you very much for volunteering for the Odyssey community and helping us with a lot of the logistics. Like Juan said earlier at the beginning, right? A lot of this is, Odyssey is an open source community. It's a community where we need volunteers. And we need volunteers like you guys who some have been around for the last 4 years, but some who are new, like 6 months, right? So it's nice to see folks who are helping and speaking up to help this make this community actually matter in areas like nutrition, as well as in
Supplement.
areas like nursing, right?
Mhm.
So it's great to see you guys, and thank you very much for volunteering and coming here and having to bear with us, embarrass you guys. So thank you very much.
Thank you, Mui. That was good closing.
Encouragement for
Yeah.
everybody else on this call
Yes.
that's been quiet that you should volunteer as well. Okay?
Yes, yes. Join the club. Join the club.
It's not that scary. You can see these three ladies have done a great job at it. Okay, so encouragement for you guys to do this.
Yes, I'm encouraging
Thank you for the
everyone.
welcome.
Yeah, Lynette, join. Yeah, okay. So thanks you everyone. As Movie said, we are not scary. Everyone can join, and so I'm really looking forward to having our regular meeting infrastructure like restored for next month's community call. So thank you guys for joining the call today, even though I changed the link a day before, but thank you everyone, and hopefully I could see you guys to next month. Okay, thank you. Bye bye. Have a good one.
Okay, bye bye.
Bye bye. Cheers. See you.